This is your Houston chiropractor, Dr. Gregory Johnson, and we have Tanjeet with us here this afternoon. And Tanjeet has been a patient here about a year ago, right?
Yeah.
And then you came back just recently.
Yeah.
After having another incident that caused you to start having some increased lower back pain, pain down your SI joints and down your legs, right?
That's right.
But you done pretty good for a long time after you came here the first round,
Exactly.
right?
Yes.
So this is really only your 7th time in the office total.
Yeah.
Right here, according to our paperwork.
Yes.
Yep.
Yep.
Very good. So what we're going to do is we're going to check Tanjeet out, show you how we fix him. So let's have you close your eyes for me, Tanjeet, and flex your head forward and backwards, please. And then neutral. Take a deep breath in, let it all the way out. Okay. Now Tanjeet has a pain scale of 8 to 9 down in his leg, so in his thighs. So that gives you a pretty good idea of how much pain he's in right now, suffering from sciatica down out of his low back and his pelvic joints, SI joints. We've got a lot of rotation in his spine because I think he's been sleeping on his side a lot and twisting a lot in his job. His pelvis is translated to the left of center, also putting more weight on his left SI joint. So what we're going to do is we're going to put him down and decompress him first on this table. So let's go ahead and lay on your back there, Tanjeet, on this one. And I want to slide down this way just a little bit. There you go, perfect. Okay, so we're going to make sure we get his pelvic bones pinned in just right. Let's go down just a little bit. We're going to get the ilium directly underneath of the pins on both sides. Same thing here on the right side, and then we're going to bring his legs up to change angle in his pelvis and SI joints, which will actually relax the lumbar spine muscles, thoracic spine muscles, all the way up into his cervical spine. And when I wrap this wet towel around his occiput, which is the base of his skull, and his chin, mandible here, we don't put it on the throat, we put it right on the mandible, and keep his head straight. Take a real deep breath through your nose, Tanjeet. Let it all the way out and just relax. Oh yeah, good. Feel that all the way down?
Yeah.
Good. Alright, good job. Now see, he's had this done a few times, so he doesn't yell out any expletives or anything anymore. There we go. Okay, drop this one right in my hand. Let me do the work. That's better. That's a Palmer diversified cervical rotary brake. We're manipulating his cervical spine in the y-axis on rotation. And the popping noise is called cavitation. That's moving the joint to its maximum range of motion. Let's turn those sideways and come over on this table. There we go. Because if you go past the normal joint range of motion, past the anatomical integrity of the ligament, you cause sprain. Let's let him tell me. So you don't want to do that. In fact, you can get hurt if someone goes beyond that and sprain your joints in your spine, and if that happens, that's no fun for anyone. See, we've had people come in here before that have had a non-professional adjusting them, and like at Christmas or Thanksgiving, you always got that cousin or uncle or whoever comes up and says, "Here, let me pop your back for you," and squeeze you from behind. You don't want to ever do that. I've had grown men carried into the office before that have had that done to them, children that have been hurt doing that, wives, ladies who have been hurt doing that. Boy, that's a great movement. Yep. Scoot up in there just a little bit more, Tanjeet. And go ahead and there you go. That's it. Okay. All you're out. There we go. I think I got all these here. Yep, there's one more. Okay. Nice deep breath. I'm going to put some deep pressure right down the pocket, right down the base of his spine. You got the multifidus, the erector spinae, and the quadratus lumborum muscles right down here at the base of your spine where the lumbar spine meets the pelvis. There's a little pocket right in there at the base that I work on really deep. And then I get out into the gluteus medius muscles here. That's pretty painful too, huh? And then over on the other side in gluteus medius, if you go down a little bit further and underneath of the gluteus medius and maximus, you'll find the piriformis right there that runs from his sacrum over to his hip joint. Right there too, that's the end of the piriformis. Same thing over here on this left side, down lower, below the gluteus medius and underneath of the gluteus maximus, you'll find the piriformis. That's pretty sore too. Since he's having a lot of pain in his thighs, more of his problems coming out of his sacroiliac joint and sacrum than it is the lumbar spine. So we're working on those muscles. Now, he's probably going to be pretty sore over here too. These are the tensor fasciolata muscles. A lot of people call this the IT band. It goes from the ilium to the tibia, so iliotibial band. So I do transverse friction across that. Is those sore, Tenji?
Yes.
Yep. So this one here's probably sore. Sometimes I use my thumb on this sometimes. Sometimes I'll use my knuckles like this, and then other times I'll use my elbow. Other times I'll pull out the big equipment, heavy duty equipment, turbonator. Something about how tough Tenji is. He took that like better than most pros do, athletes. That is a very deep myofascial release instrument that I had designed from just a regular old Black & Decker drill, or saw actually, that a patient of mine retooled it. If anybody wants one of those, he can actually custom make those for you, so you can leave a message on our YouTube channel about it if you want, or leave your email address on that. My email address, by the way, if you want to send me information or questions directly, is yourhoustonchiropractor@gmail.com. Please no sales solicitations, though, only questions, and if you have a condition you want to know about. You can also reach us through our website, contact information, or make an appointment through our website at www.advancedchiropractic.com. Most of our patients are referrals, but YouTube is actually becoming second to referrals in the number of patients that we see in this office, because people see the difference in what we do in this office compared to what they see in a lot of different chiropractors' offices, including some that you might be going to right now if you're watching this. We get a lot of patients coming here that have been under the care of other chiropractors, because the other chiropractors don't spend as much time with the patient as I do, or do the amount of work that I do on a patient. So they want to come here where they're going to get personalized, individualized care. And you see, we treat one patient at a time, appointment basis only. So we divide our time up throughout the day to treat everybody specifically for their problems, and devote that 100% of my time, effort, and energy and focus directly on that patient's problem. And I could talk and do all this and chew gum at the same time, so that's why we do these YouTubes and explain what I'm doing. Right now I'm doing an oblique lateral stretch in his lumbosacral spine. It's still pretty tight, but it's looser than it was. I'm going to hit his right SI joint again, right there. Sacrum straight superior to inferior on the y-axis, and then the left SI joint and hip joint right there. I think I got all these already. I'm sure I did. Yep. Okay, good. So, Tanjeet, let's have you turn on your back one more time, please. Now, since he's been having problems with his thighs and legs all the way down into his calves and his feet, I've actually been checking his feet and adjusting those as well. He's got a little bit of a fallen arch here on this left foot. So we adjust that. And then I grab the toes, the phalanges here, and pull them straight away. As long as you're pulling them straight out, it won't hurt any of the joints or cause issues with them. It's when you jam joints or traumatize them that you get arthritis in them from popping your knuckles, that kind of thing. Adjust his ankles there on both sides. Now just let your whole leg relax. Okay, now one more here. There we go, that was better. Do you feel that in your knee and your back, Tanji?
Yes.
Okay.
I felt like all the way down.
All the way?
Yeah.
Let this leg relax.
Yeah.
There you go. Just breathe. Let this whole leg go limp. There we go. Good. You have to really kind of feel the patient. Wait till they breathe and go limp. Let's sit you up, face towards your knee now. Sideways. There we go. Good. Let's get back this way just a little bit for me, please, sir. Okay. Now we're going to evaluate his shoulders bilaterally. Excellent movement there in the glenohumeral joint. If you notice on every patient, we do adjust them literally from head to toe, all the joints, because they're all connected. And in the human body, everything is connected to everything. So even though he's got low back and leg pain, we're going to treat his cervical spine as well so that he can have a good biomechanical alignment from his head all the way down to his sacrum, because his head needs to stay right over the sacrum and head up and back to keep the pressure off his low back. So let's come over here in front of the mirror. Now we're going to shoot you. I bet that feels better already though.
Yeah, it's like it took a lot of pressure off my lower
The
back
leg.
and the leg.
Good. Okay, so let's flex you forward and backwards for me, Tanji. Neutral. You still got a little bit of the forward head posture, right? So what I'm going to do is I'm going to put him in a mirror image. He's also still translated to the left, so he's putting more weight bearing on this left side. So lift both shoulders up and pull them back all the way. Clear your hands way back like that. Good. Then we're going to bring your head straight back this way. We're going to translate you this way to the right. I want you to shift your pelvis straight right now too, as far as you can go with your pelvis. Further right? Yeah. Okay. Keep holding that. There we go. Now, once you just relax again and flex your head forward and backwards again and see if this feels any smoother to you. Oh, yeah. Better range of motion. Yeah. Yep. See, that got him straightened up better, but watch this. I'm going to push his head forward now to stretch out the trapezius muscle, and I'm going to bounce his muscle spindles and Golgi tendon apparatus in his traps, greater scapula muscles, bilaterally down into his rhomboids, middle trapezius fibers, and then even down into his lower trapezius fibers where they attach down into T10, T11, T12. Okay, now, when you flex, start at neutral and go forward and backwards again and see if this feels any smoother.
Yeah. pretty much.
What's the range of motion? Back all the way? Yep, much better. That feel easier to you that time, Tanjeet?
Yes.
Yeah. Would you mind sharing with our YouTube subscribers and viewers what your experience has been here and what brought you here and what keeps you coming here?
I just saw Dr. Johnson online, and then I just
on YouTube?
On YouTube and on Google.
Yeah.
And then I thought about coming here and give it a try. And last time when I came, he just fixed me completely within 5 or 6 minutes.
Yeah,
I guess.
4 or 5, I think.
Yeah, and then somehow my job, I did some wrong movements, and then the pain started.
But that was over a year later.
Over a year later or so.
Yeah.
I came back again. Hopefully, I will be.
This is only your 3rd treatment since
Yeah.
you've been back.
Yes.
So
Yeah.
you're making good headway already, I think.
Yeah, I'll be normal again maybe pretty soon.
By next week.
Yeah.
Yeah.
I
Yeah.
hope.
That's good. You will be if you keep
Yeah.
doing things we talked about. And you're doing your home exercises, right?
Yes.
Good man.
Yep.
Thank you for sharing that with us,
Thank you.
Tanjeet.
Thank you.
Thank you for being with us. This is your Houston chiropractor. We'll see you next time.